So a common question I'm asked by patients is, what is a herniated disc? So I think the best way to understand this is by looking at an MRI and trying to understand a more normal MRI to one that has a clear herniated disc. So when we look at the MRI and we look at the disc, which is the cushion that separates the bones or the squares in the back called the vertebral bodies, the disc, I explain to patients, kind of looks like a jelly donut, where you have the jelly on the inside with the donut on the outside. This jelly material is called the nucleus pulposus, which attracts water and kind of acts as a shock absorber. The outer layers, kind of like the outer layers of an onion, is called the annulus fibrosus. These outer layers are stiff and they hold the jelly inside the donut to allow it to act as a shock absorber. The discs are the structures in the spine that allow us to bend, twist, and move side to side, and ultimately give the motion to our spine. When we look at a herniated disc, we should understand what a normal disc looks like first. Typically, we want to see the discs look homogeneous in consistency, meaning when we're looking at one disc compared to the other levels, they all look consistent. So we want to see a nice jelly-filled center that's usually bright on a T2 image, meaning it's nice in kind of a light gray shade. When we talk about looking at an axial series, which is like cutting the MRI like a slice of Wonder Bread, we want to see that the inside has a nice white consistency, demonstrating a healthy nucleus pulposus, and that the outer annulus fibrosus is consistency, kind of following a kidney bean shape. So when we talk about a herniated disc, this refers to a weakening or potentially a complete tearing in the outer onion layer of the annulus fibrosus that allows the soft jelly-like material to push out into the spinal canal, which could put pressure on a nerve root or nerve roots that could cause unpleasant symptoms, like we've talked about before, radiculopathy, which could be a shooting pain, a numbness, or an unpleasant electrical sensation going down the arms to the fingertips or sometimes to the legs all the way down to the toes. So understanding this, we could look at an abnormal picture of a herniated disc to see what it looks like in comparison. So this patient that ultimately went on to need surgery in the form of a minimally invasive microdiscectomy had a tear in the annulus fibrosus where some of the jelly material called the nucleus pulposus was pushed out or extruded. When we look at this on the sagittal series, which is cutting us down the middle, and comparing it to the axial series, we can see that this disc material, the gray material here, has been pushed out and is now placing pressure on the nerve root, which in this case causes pain going down the back of the leg, almost like sciatica, all the way down to the foot. So a herniated disc refers to a outpouching or a pushing out of the jelly-like material into a place where it should not otherwise be. And depending on where this herniation may occur, it can sometimes cause unpleasant symptoms in the arms or the legs, respectively.